I'm Chen Chen. I'm the tech support engineer from High Sky. And so recently, some doctors asked me about how to measure patients who has ascites as a fluid at the right upper quadrant. Usually, it's cirrhosis patients using our FT machines. So I will show you the experience that I get. Okay, so when we doing the measurements, we can see the first picture. The left picture is there are two pictures. The left picture is I mode, and the second picture is E mode. And when we're doing the measurements for those patients who have the ascites or fluids at the right upper quadrant, you might see some dark areas on the I mode, and it shows from left to the right direction, and it might indicate the fluid on the measurement position. So the picture will show on the first picture. So that is the wrong picture we need, because as we know that we use a shear wave to do the measurements, and the shear wave could only propagate in the solid and not in the liquid. So what we can do is that we can move the probe along the intercostal space to try to avoid the fluid parts, to try to avoid fluid interferences and do the measurements. So for the round picture, we can see in the middle, in the red box, it is there's black areas. It might indicate the fluid or ascites. So we need to change the position, and until we get the correct picture on the right one. So you can see that we can see the steady layers on I mode, and we can also see that from top to the bottom, the brightness of the I modes there's no difference, no big difference. And for the A mode, the straight line, if you can see the straight line, it is very straight, and there will be no ups and downs. So it means there's no peak or valleys in the A mode. So it is a very straight line. So that is the correct picture. And the second case is just like this. If you can see that for the round picture, you can see at the bottom they are totally dark at the bottom. And for the A mode picture, we can see the A mode picture, the straight line is laying on the right side. So it means there's some interferences. That is the fluid interference. So we will change the position, we move the probe along the intercostal space. Or maybe we can change to another intercostal space to try to avoid the fluid part. And then we will get the correct picture, like the right picture. It has the steady layers from top to the bottom, and you can see there's no big difference of the brightness. It is the gray layers, not black or not white. So that is the correct picture. And we have two kinds of correct pictures for those cirrhosis patients, because for some patients, their liver is very small. So at the bottom of the I mode, you might see that there's some non-liver tissue. There's a white part at the bottom, but it is very small range, very small. So it is also the correct image. It shows that the position we choose is the liver, and there's no big interferences. And that is one correct picture. And for second correct picture, we can see that is the picture as we just showed. It means that from top to the bottom, they are all gray layers. It's steady layers, and we can't see non-liver tissue. So this is also the correct picture. But if there's some fluids, if the position we choose have ascites or fluids, you may see some dark areas from left to the bottom. So that is the point that we need to change the position. So as I just said, that's why we measure patients with ascites, we need to avoid those fluids, because the shear wave, it has the features that it could only propagate through the solid. It can't go through the liquid. So that's why we use we have to avoid that part, and that is a shear wave, and that is FT. That is T technology. So, but not all the patient who has the ascites or fluids could do our measurements, because for those patients who have a small part of ascites or fluids, we could try to avoid that interference and proceed. But for those patients who have a great deal of ascites and fluids, we don't suggest them to do the FT measurements, because if we can't avoid that part and we can't get the good image of the I mode and A mode, we cannot do the measurement because the shear wave could not propagate in the liquid.